Hello, and welcome to an introduction to Counseling and Psychological Services, CAPS. My name is Aaron Cohen, and I am a staff psychologist at CAPS. I use he and him pronouns. This training will introduce you to CAPS and our services. For the most up-to-date information on our services, please refer to the website listed at the end of this training. Health and wellness is a campus responsibility, and not just a responsibility of the University Health Services and CAPS. When students struggle, they will often use supports on campus, such as advisors, student groups, and mentors, but there are times when seeking professional services can be helpful. If your usual supports are no longer working, things feel overwhelming, or you just want to seek the advice of a professional counselor, CAPS has support services for you. Students use CAPS services for a number of reasons. Our counselors are trained and have extensive experience working with undergraduate and graduate students and understand the unique issues of being a Cal student. Our counselors are diverse, not only in how we identify ourselves, but also in our areas of interest and expertise. It is important to connect students to the right supports at CAPS and the counselor who would be a good fit for a student. Sometimes that is based on identity and sometimes on presenting concerns. Confidentiality is also key. Students come to CAPS for a protected space to talk about their concerns, knowing that the information is kept within the counseling center. CAPS offers a wide range of services, and while students often think of individual counseling when they think of CAPS, we want students to know there are many services which could benefit them. The following services are available to all registered students regardless of health insurance, and there are no charges to use them. There are many services available for students online and not needing to see a counselor. Some students will benefit from education on a number of concerns and can get support through the different resources on the CAPS website. Students also have access to Therapy Assist Online, a self-help program which promotes self-paced support on issues such as stress, anxiety, resilience, depression, relationships, and communication, to name a few. Therapy Assist Online also has a library of mindfulness and relaxation exercises available to all students. Students can also participate in online workshops, both recorded and live, on topics that are of interest to our students. Please see the website for the most up-to-date offerings. Our career library offers a number of services for students wanting help thinking about careers and majors. While the previously discussed supports can be accessed without talking to a counselor, there are a number of services we offer to talk directly to a counselor. Some students have a very specific concern and can benefit from our one-session single counseling. For those students, they can sign up for single-session counseling. Other students would benefit from our groups program, which has a number of skills-based groups, support groups, and therapy group options. Groups offer the opportunity to share for a shared experience and learning not only from counselors, but from peers. Some students benefit from our short-term counseling model, needing more than one session. When engaging in counseling at CAPS, the average session use is about 3 to 4 sessions. Many students benefit from 3 to 4 sessions, meeting every number of weeks to get the support they are wanting. If a student is wanting or needing more than the short-term counseling and would benefit from more regular meetings with a counselor without session limits, then CAPS offers support connecting students to community providers. Students can now view our referral website on their own to connect to community providers, but if they are also needing assistance from CAPS, we can help connect students regardless of the insurance. If students are needing a connection for a medication evaluation, CAPS provides support in the counseling center and connecting students to the community. There are fees and insurance limitations connected to CAPS psychiatry. CAPS also has urgent drop-in hours, which will be discussed in the next slide. How do you connect with CAPS? And there are a number of ways. Please see our website to connect to the self-help resources, Therapy Assist Online, our Career Center, and workshops. For more information on these services and our other counseling services, students can also start by having a phone triage appointment. You can schedule this brief appointment by either calling CAPS directly or setting up the appointment online at Tang. This initial triage appointment is helpful to get a sense of what students are wanting and tell students about our services with the goal of connecting students to the best resources. Our Let's Talk drop-in hours are another access opportunity for students who are not sure if what they are wanting. Let's Talk hours are consultation hours for students to meet with a counselor and ask questions about the process of counseling. Lastly, if a student has an urgent concern and wants to talk to a counselor, they are encouraged to call the CAPS during the day or our after hours during the evening, nights, and weekends. There are counselors who can assess urgent concerns and provide immediate support as needed. Lastly, please know that during this time, all of our services are virtual or by phone. If you're having an urgent concern, please do not stop by the Tang Center currently. Instead, call that main number, 510-642-9494, or our after hours number. Thank you so much for listening to this brief introduction on CAPS services. Again, please see that link, uhs.berkeley.edu CAPS, for the most up-to-date list of services and times. Thank you again.